Going into a vaginal delivery, we want to minimize the amount of tearing that happens. What we do know is 53 to 79% of women are going to have some sort of perineal laceration during labor and delivery, but we want to reduce the grade of tearing. So those 4 grades of tearing include this. Grade number 1 is through the skin or mucosal layer. There's nothing required for recovering from that besides a little TLC. Grade number 2 is when you actually tear through a little bit of the musculature. This requires a couple stitches. Grade number 3 is the muscle and a little bit into this anal sphincter. Grade number 4 is when you tear the skin, the mucosal layer, the muscle, and all the way through the sphincter. Grade number 3 and 4 require surgery usually. So the lower grades are easier to recover from. The great news is there's lots of things that we can do prior to labor and delivery to get ready for it, including moving a specific way. Our pelvic floor has to stretch and move out of the way during labor and delivery so we can stretch our pelvic floor. Check out our perineal video, which you can start at 34 weeks of pregnancy to help stretch this area. We can also do this with our breath, and just learning how to let go of this area is quite helpful. But let's get into the meat, which is the 5 things that you can do during labor and delivery that might reduce the grade or amount of tearing you experience. Step number 1 is making sure that we're changing positions and staying upright during labor and delivery. There's 3 different areas that your baby is gonna have to go through in the pelvis to come out. So this is like an obstacle course. We can make these areas wider by doing certain movements, and also gravity is gonna help the baby move through this if we can stay upright. It is a delicate balance though between resting in between those contractions. The uterus is a muscle. It needs glucose. It needs fuel to function properly. Usually in the hospital setting, you're not allowed anything by mouth, meaning that we're gonna run out of energy. So we highly suggest using these electrolyte drinks, having your partner support your trunk to take some weight off, really conserving energy, but moving and staying upright. Knowing how to work your breath can also help you out so much. So open glottis breathing is when we take a nice deep inhale and then we keep our mouth wide, and you can either grunt, make a noise, or breathe out as you bear down to push. So it looks like this: inhale, exhale, or no noise, but just pushing air out. Closed glottis breathing might look like this, like push as hard as you can, keep your mouth closed, don't breathe, bear down. This creates more pressure in, so it also creates more pressure on our pelvic floor, so that you can see an increased rate of vaginal tearing with this, but it might shorten labor and delivery. So that's why a lot of healthcare teams will use this. If you really would like to try that open glottis breathing, maybe saying something like this to your healthcare team can be super helpful. I really want to trust my body and my own urges and listen to my body when it wants to push. I would prefer not to get instruction on how to breathe during labor and delivery. Thank you. Steps number 3 and 4 really come into play once you feel like that ring of fire sensation where things are getting a little bit more intense. So your provider could do perineal massage. Let's be honest, once we're at this point, there's not a lot of modesty. So having them massage that back area can be quite helpful to make it more pliable. Also, adding a warm compress to this area during labor can be helpful to make it more pliable. Lastly, we want to consider what your pushing position is. There's more optimal positions. There's not one right way or one wrong way, but there's a couple of tips that are really going to help you. So if I can increase this space between these bones, you see how it's easier for baby to come out. Additionally, we want our tailbone to get out of the way. So being in quadruped with your knees in, ankles out makes that space wider. You could have your body supported by a bar or a bed in quadruped. So anytime that the knees are in, ankles are out, if you have an epidural on board or you do want to lay down, laying on your side, I can still create this position by having somebody either hold my leg with my knee in, ankle out, or I could put that on a peanut ball right here, but that's really going to make pushing less difficult in these other positions. In your provider or you would like to lay on your back, having a towel roll under the right side of your sacrum can be helpful to also create space. Hopefully these tips make you more empowered for your labor and delivery. We also have a labor and delivery course which goes over all of those different positions and so many more tips for labor and delivery.